Hi, everybody. My name is Adam Monti, and I'm here today with.
Matt Manti.
There it is. We're doing a socially distanced video today. We just want to give you a quick update on COVID here at our two communities, Sky Valley and Caliente. I'll start with our employees. About a month ago now, we had an employee get sick and test positive for COVID. It was an office administrative person. They did all the right things. They started feeling sick on a Friday afternoon. They went home. I believe it was a headache was the first symptom. They got tested. They got their test back in the following week, and it was positive. They did experience a lot of fatigue, but no other symptoms besides, I believe, headache and fatigue. They tested again after the symptoms subsided. They did 2 negative tests. They're now back at work. Now we had a second employee whose husband started feeling sick, and in the time that he was waiting for his results of his test, his wife came to work, showing symptoms that I believe she thought it was maybe just allergies. They were mild. When her husband got the tests results back positive, of course she did not come to work, but it did lead to, as of today, 3 positive tests to other employees that she was in contact with. Now, we tested a bunch of employees beyond that. Most employees, of course, came back negative, but 3 did come back positive within the circle that she was in. And so a real lesson here is when you feel sick, go home. Even if you think it's mild and allergies, go get a test. Because that's how these things spread, is when you're sick and you don't follow the protocols. Now, that's here at work. Let me just say, those employees have been, we quarantined everybody. The negative people are now coming back. The positive people, of course, still at home. We have one person without a result still at home. So you're safe to interact with our staff. But again, we're not doing in-person contact right now. Even regardless, we're doing phone and or online. Now, Matt, why don't you give us an update on our communities?
I am very, very proud of the way that this community has responded to this pandemic. We know unequivocally the primary way in which this virus is transmitted is close contact with an infected person. And to date, we have had 2 confirmed cases, couples at Sky Valley. We have had 2 confirmed that are now over it at Caliente, who have now tested negative twice. And we did just hear about someone last week who came down with it. The person is aware of it. They have done tracing, and they are completely isolated and working with medical professionals to get through this. So, I want to reiterate that what we want to do as individuals is to keep our distance. Physical distancing is crucially important in stopping the spread of this. But also, we get I shouldn't say a lot, but we get some number of requests. People say, hey, can you get the gyms back open? Can we get one of the rooms open, to gather? And, at this point, we are following all guidance from CDC and healthcare professionals, as well as the state of California, and keeping those closed because that represents the highest risk activity and environment in the spread of COVID. So we want to get them open as quickly as we possibly can, but the health and safety of all residents is our primary concern. And so we will continue to monitor the situation closely, and as soon as we can get it back open, we will.
Let me just say that I think that, outside, the reason that probably the state of California doesn't have a lot of restrictions for outside church services or outside events, they did have some, but, is because outside there's so much ventilation that it's hard for it to spread. So a conversation outside with somebody, even within 6 feet, they don't see a lot of spread. They see it. What are they doing? They're closing down bars. They're closing down indoor restaurants, indoor spaces. So I think we can all be encouraged that being outside, we can be a little more social and safe outside. So I'm really encouraged. We don't see a lot of community spread among our employees or in our communities. I think it's largely because people are outside.
Yeah.
I think that is really the safest place to be. So I'd encourage you all to get outdoors and not worry so much about people being outdoors and getting sick. If we see it happening, we'll take the proper precautions. All right. Thank you very much for listening today, and stay safe.